Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position. All right. For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and they're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. All right. So when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion, and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. All right. Now, in terms of, just before we go, I just want to also mention that for some joints, there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range. And you perform the test within their available range that they have. All right. So this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. So today we're going to be doing MMT for elbow flexion. That's manual muscle testing for elbow flexion. Now the primary movers for elbow flexion are the brachioradialis, the biceps brachii, and the brachialis or the brachialis muscle. Alright, so we'll have our patient in a short sitting position. This is the starting position for MMT for elbow flexion. Patient or the subject in short sitting position. On the surface, the feet can either be left dangling or independent rather, or it can be flat on the floor or dependent. Alright? The position of the therapist or the examiner is to the side, front side, face the patient, so you can also see the facial expression while performing the test. Now, I had mentioned 3 main muscles, the primary movers for elbow flexion, the brachialis, the brachioradialis, and also the biceps brachii. And these 3 muscles are tested. They can be tested individually, okay? So, for the biceps brachii, the forearm is supinated, or the palm is facing up, elbow tucked in, elbow at 90 degrees flexion, tucked in. This is the starting position. As it relates to the biceps, as it relates to the brachioradialis, the forearm is in neutral position or thumb facing up. As it relates to the brachialis muscle, palm facing down or forearm pronated. Palm facing down or forearm pronated. So remember, the biceps brachii is supinated, brachioradialis in neutral or thumb facing up. And for the brachialis, the forearm or the palm facing down, it's pronated. Okay? And the same principle for all of them as it relates to the flexion. So I'm going to just do for biceps brachii, and then that same principle can be applied for the other 2 muscle groups. So the instruction that I'm going to give is go ahead and bend that elbow, bend its elbow, bring the arm all the way up to the shoulder, good. So the person is able to complete a full range of motion, you already know that that's a grade 3, all right? So I'm going to go apply, the stabilizing hand will be by the shoulder here, applying the counter force, and the hand that will be applying the resistance will be by the forearm, distal forearm, or at the level of the wrist, all right? Distal forearm or level of the wrist. And you're going to be given the instruction, don't let push it out, keep it there, keep it there, keep it there. And she's able to hold against maximal resistance, and that's a grade 5. If it is that she breaks under maximal resistance, then that will be a grade 4. If it is that she's able to hold with moderate resistance, then that will be also a grade 4. So this is MMT for grades 3 to 5. As it relates to, you can go ahead and put it back down into a neutral position. If it is that you want her to just perform a grade 3, then the stabilizing hand will be right here by the elbow. So you're cupping the elbow instead of the shoulder. And what you'll be doing is go ahead and lift that arm all the way up again, and that will be a grade 3. Next, I'll be showing you MMT elbow flexion for grades 2 to 0. So for grade 2, the patient is in the same short sitting position. It can also be done in supine, which I'll be doing afterwards. And you're going to go ahead and abduct the elbow. Elbow will be abducted, 90 degrees abduction. And the therapist or the examiner is supporting the arm and also the forearm. All right? Now the instruction I'm going to give is go ahead and bring the hand inwards towards you. And this will be a grade 2. So the patient is able to complete the full range of motion, or the available range, in this position. It's a gravity minimized position for grade 2. All right? Go ahead and bring it in again. Good. So this will be a grade 2. Now if the person is unable to sit up for whatever reason, then they can lie supine. I had mentioned before the alternate position for grade 2, which is in supine position here, as you can see the patient in. And the position of the examiner is at the head of the patient here, beside the testing arm. Alright? Now, what you're going to say is go ahead and bend that elbow. Go ahead and bend it up. Bring it, like you bring it to the face. Okay, good. So the person is able to complete that available range of motion in this position, and that will be a grade 2 MMT, 2 out of 5 MMT for elbow flexion. And depending on what muscle group you want to test, if it's brachioradialis, brachialis, or the biceps brachii muscle, then you position the arm accordingly, as I had previously mentioned. All right. As it relates for grades 1 and 0, then go ahead and bend. If the person is unable to move or bend the elbow, but you can still feel some contractile activity going on there by the elbow, then that will be a grade 1, a trace in terms of MMT. You'll be 1 out of 5. That's how you'll grade. Okay? If it is that there isn't no sign of contractile activity any at all, and you're not feeling anything, there's no palpation, it is not palpable, and you're not seeing any signs of it, then that will be a grade 0. It will be 0 out of 5 as it relates to MMT elbow flexion. So this is manual muscle testing elbow flexion.